Well, let's continue the discussion about innovation with our next guest, who is an industry leader and in this market, and he's now heads up Brighton Health Plan Solutions. It's the parent company of MagnaCare. But joining us on the program is Simeon Schindelman, CEO of Brighton Health Plan. Simeon, good morning.
Good morning. It's great to be here. Thanks for having me on the show.
Yeah, great to talk to you again. Tell us about your new role here in heading up Brighton and what's Brighton up to in MagnaCare.
Well, Brighton is this is a really exciting time for the healthcare business generally. As I imagine anybody who's listening here and is interested in what we're talking about would probably agree that the rate of change and the amount of change happening across healthcare is higher than any of us, even somebody like me who's been in this business for over 30 years that we've experienced in the past. That creates a ton of opportunity. Brighton Health Plan Services is a division of Brighton Health Group. And the Health Plan Services side is made up of MagnaCare, a business that's been around here in the greater New York, New Jersey area for several decades, serving the self-insured marketplace generally and having a particularly strong presence in the Taft-Hartley market. In addition to that, we have commercial business, and we have some what I think are very interesting and exciting ideas for some additional product we'll be bringing to the commercial market over the balance of this year.
That's exciting stuff. Yeah, we've had Joe with us before at MagnaCare, who spoke at our events before, and we look forward to having you be at one of our events in the near term. So, can you talk about some of the new things that's coming?
Absolutely. I'd love to do that. One of the reasons that I joined this organization, Brighton Health Plan Solutions, is that the parent company, Brighton Health Group, has two very important assets. And one of those is the health plan business where I'm CEO. The other one is a physician management business, which sits next to me. These are the two organizations that make up Brighton Health Group. And I talk about this because our physician management business is a practice management company that's called Privia. And Privia is actually, right now, the fastest growing physician practice management company in America. It focuses on primary care practices. Privia also has an organization called Dwell Family Doctors. That's a staff model primary care service. And I tell you that story because when we think about what we'll be bringing to market and the changes that we'll be trying to drive, they incorporate combining what primary care physicians do every day with what health plans do. And we have both of those assets here at Brighton Health Group. And that's because we believe that the primary care physician has tremendous impact on cost and quality, and we intend to elevate the role of the positioning, the visibility of the primary care doctor, and that will lead to very meaningful improvements in both the cost and quality delivered by the healthcare system.
Simeon, is there, with your primary care, practice management group, is there going to be a movement towards adopting the direct primary care business model with the groups?
Well, we think the model that we intend to follow, well, I guess I should say we would have several models, because in the end, our focus will be on not only elevating the position and the influence of the primary care doctor, but making sure that access for everybody who's part of our plan is very easy. So you'll see several models of how primary care physicians are accessed, from relatively tight models where services should be accessed first through a primary care physician, through models where our presence in the market with both managed and staff model practices simply make access easier for all of the individuals and families that we serve. So I hope that's somewhat helpful. But the point is that the more we can get the primary care doctor involved without unduly restricting the access that our membership has, that combination is going to be very powerful for downstream utilization of services, downstream plans of care, relationships between primary care and specialist physicians. And so what we can have, because of that stream of information and that connection with doctors, has a chance to have important value for our customers.
That's very interesting. Ron, do you have a question for Simeon?
Yeah, Simeon, I think you said one of your sweet spots is the Taft-Hartley plans, the union plans. And you're in a particular high-cost market anyway in the New York, New Jersey area. And I'm wondering about what are referred to as Cadillac plans. A lot of our listeners out there have been dealing with the potential of this extra tax that's in the Affordable Care Act if their benefit levels get too high. And that's particularly an issue with many union plans. We know that the legislation recently delayed that for a couple of years. But what are you doing to help your union plans that may be in that position of high-cost plans and they want to stay under any potential Cadillac plan level?
So that's a terrific question, and that's a very important question because it places what we would think of as an undue burden on the plans that provide rich benefits. So let me share three comments about how we think about that. Number one is, frankly, we anticipate the Cadillac tax will be moved out more, again, beyond the duration it was already moved out, and then it's quite possible it won't come to fruition. That's one. Second is that what the Cadillac tax ends up doing to a great degree is it places this undue burden on the plan sponsor and on the individual participant because it increases the liability at the individual participant level, either one way or another. One way by benefit levels get reduced, they become less rich, and so the liability at the member level is higher, and that's not a real good result. Or premiums go up because the tax gets passed on to the participant by the plan sponsor. So number one, we think it'll be pushed out again. Number two, we think it'll be pushed out because it's probably not as good an idea as it may have appeared a couple of years ago. All that said, we've got to be prepared. And that's why the work that we're doing, we think, is so important, because the only other way to address this is to figure out how to deliver the same necessary and important level of care that people get today at a lower cost structure today, which is why our approach is something we believe very strongly can reduce cost and help keep plan sponsors, especially these Taft-Hartley funds with relatively richer benefits, under Cadillac tax levels. So it really ends up becoming, to be prepared, figure out how to deliver great care at better cost as opposed to simply how to reduce benefits.
Simeon, one of the other challenges that plan sponsors have in dealing with their workforce is the 80-20 rule. 20% of the people driving 80% of the cost. What are you doing to really help plan sponsors deal with that?
That's a question we think about a lot, because for plan sponsors to manage costs, they need to understand who the highest cost people are, and what's driving cost. And when we analyze this practically every day, and the reason is we think that understanding exactly where cost is incurred within the population is probably the most important step towards reducing total medical cost. And I say that because the 80-20 rule is at least 80-20 in healthcare. So to the extent we can help plan sponsors help their participants make the best decisions about courses of treatment, about programs that reduce chronic illness or repeated needs for visits to expensive sites of service and kinds of service, and three, getting services from the most cost-effective physicians and locations, we can have a very significant impact on cost. It's actually I probably wouldn't be overstating it to say we think this is the number one place we can help, is this 80-20 rule idea. So we look at this every day. And I'm going to now track you back to what I said about primary care. We know with a high degree of confidence that primary care doctors have a lot of influence on the utilization patterns of individual plan participants. We see that in our data. And so we believe that through our staff model and our managed physician practice management businesses, that we believe that through those businesses, if we can help the primary care physicians introduce the knowledge and the information to plan participants so they are incented to choose the most cost-effective courses of treatment, the most cost-effective places of treatment, and the most cost-effective physicians providing the treatment, always keeping quality in mind, we can materially impact costs. This is right in line. This 80-20 rule is totally in line with our business plan and how we think we'll bring real value to plan sponsors. We're very, very excited about that.
Simeon, do you, with a lot of the services that you're talking about, and are you rolling this out and to have a national footprint? I know MagnaCare is in a specific geographic market. Are you going to have a national footprint?
So that's a topic we also talk about a lot. We have a three-stage plan here, and I'll try to briefly describe it, and then maybe make sense of it at the end. The first stage is we pay a lot of attention to our Taft-Hartley Fund clients. That's a very important part of our business, and we have a long history with Taft-Hartley, so they're very, very important to us. Number one on our strategic plan is to be very, very solid with Taft-Hartley funds, both the clients we have today, and to grow that business. Number two on our strategic plan is to introduce a broad commercial market entry that incorporates very important advanced solutions to issues that we've talked about in this discussion. The 80-20 rule introduces better tools that help participants and primary care physicians make good choices about courses of treatment and location of treatment and who to get treatment from. And we think of that as a good way for us to have an effect on the commercial market. We'll also bring those tools to the Taft-Hartley market. But we'll build that in order to help push our commercial entry to a more rapid achievement of success. The third element of our plan is geographic expansion. And we're actually working on all of those right now. We're simply pressing we have our foot on the gas a little harder on number one, making sure we continue to be very strong with Taft-Hartley.
Sure. We
also have our foot on the gas pretty strong on the commercial entry, and we have it on strong, but not as strong on geographic expansion. So we're simultaneously working all of those. And we do anticipate that our model will be very relevant in a number of other cities. And we have work going on in a handful of cities around the country already.
Simeon, time flies when we're having fun. This has been a great discussion. You're doing some very innovative things. We've got about a minute to go, and I want to allow you the opportunity to recap and actually tell our audience how they can connect with you.
Well, people ought to feel free to reach out to me at MagnaCare. On the MagnaCare website, you can find a CEO email address. Literally, I believe it's ceo@magnacare.com. And you can just type that directly into your email. Let me know. I would love to hear from people. I'm very focused on this business, enjoy it a great deal, and I love talking shop, guys. So anybody who wants to reach out to me should feel free to do that at any time. We believe in the butterfly effect. So not only are we working on what we think are going to be some powerful tools for our clients, but we think we'll demonstrate a few ways to improve the healthcare system, and that others will follow our lead and make some additional improvements. And so we're working not only for the benefit of our current and future clients, but we're working for the benefit broadly of the healthcare system, and we're very, very motivated by that vision.
Simeon, appreciated your time and discussion today. Very interesting. You have a great weekend, and we'll talk again real soon.
Thank you. I very much appreciate it, gentlemen. Thank you.